Today, let me take you through how levothyroxine, under the brand name Synthroid, can be very helpful in infertility, pregnancy, and to the newborn. Without further ado, let's go. For better understanding of this topic, that is Synthroid in infertility, pregnancy, and newborn, let's get all the facts about hypothyroidism. And you can get that through this link. About subclinical hypothyroidism, yes, it is necessary. But how can we get it fast? You can go through this very link. Uses of Synthroid. Let's check through this link also. It would be nice to know how good your thyroid gland is by doing thyroid function test, because that will lead us to whether or not you will need Synthroid to help you. So, if you're a woman of childbearing age with irregular menses and some other symptoms of hypothyroidism, have it done. If you're a male and you are impotent, or you have sperm anomaly, low sperm count, and the rest, have it done. If you've been having miscarriages, but the cause is not yet known, have it done. Infertility cases, not yet defined as per the cause of causes. You are pregnant with certain symptoms. By the time I'm done here, you will know whether you need thyroid function test done or not. In all newborn babies, it is wise to have thyroid function test done. How could Synthroid be helpful in infertility? If you are a woman of childbearing age, but you are having difficulty becoming pregnant, and you notice that you have symptoms of hypothyroidism associated with irregular menses, then Synthroid will be helpful here. If you are a male, you are finding it difficult to impregnate your spouse, your wife, and they've told you that your sperm morphology and motility not too great, or you have low sperm count, and you have known by yourself that you are impotent. Please, let's get that determination as per thyroid function test, TSH, know whether you are dealing with hypothyroidism, and the Synthroid could help you, and the two of you could become parents. When someone tells you that Synthroid could be helpful in pregnancy, yes, that is true, because if you are pregnant and you have hypothyroidism, you can face certain complications, such as preeclampsia, miscarriage, anemia in pregnancy, massive bleeding after birth, and congestive heart failure. But if you are given Synthroid, that will alleviate the problem. Sometimes the signs and symptoms of hypothyroidism and the effect of pregnancy could overlap. Like you are becoming fatigued, gaining weight, depression in some individuals, you are becoming constipated, you have shortness of breath on exertion, the heart rate is low or bradycardia, you have carpal tunnel syndrome or inability to concentrate, even having increased sensitivity to cold. Synthroid will help in the newborn. If the mother is having hypothyroidism and the baby is delivered with hypothyroidism, there will be problem while growing up. So neurodevelopmental anomalies will set in later in life. All these could be averted using Synthroid. Synthroid for the treatment of hypothyroidism in pregnancy is good. no issue, right? Except that we have to determine the dose based on the severity of the condition and then the clinical state. Because if we give too much, we'll tilt the individual to hyperthyroidism. And that is another different issue entirely. So we'll keep an eye on TSH. I will go into how to assay TSH in a bit. We cannot give Synthroid with many other medications. For example, not with multivitamins, not with iron or antacids, not with calcium supplement, and not with bile acid sequestrants. No. Then, what can we do? We can give our Synthroid first, wait 4 hours before we give the multivitamins, iron, antacid, calcium, and the rest. Or we'll give the multivitamins, bile acid, sequestrant, or the rest 4 hours before we give the Synthroid. So there must be at least 4 hours gap. Our goal while on Synthroid in any pregnant woman will be TSH less than 2.5 milli international units per liter. Okay? The normal range is 0.4 to 4.0 or 0.4 to 2.5 milli international units per liter. The reason why I have decided to put this there is that some authorities will settle for 0.4 to 4.0, while others will say it is 0.4 to 2.5. But our goal here is to get TSH down to less than 2.5 milli international unit per liter. And we will do this by getting the TSH acid every 4 weeks until the mean gestational period. Once the pregnancy is advanced at 30 weeks gestational age, we will do it only once or twice. Needless to say anyways, because if you do after 30 weeks, if you come back 4 weeks, that would be 34. And if you come back 2 times, that would be 38 weeks and the baby's almost out there. In postpartum thyroiditis, we will continue to assay TSH level every 4 to 8 weeks. Thyroid stimulating hormone, as might be clinically indicated, could be determined at any time based on the decision or the judgment of the physician in charge. In conclusion, I've stated that Synthroid will be helpful in certain conditions causing infertility. That is, if it is involving hypothyroidism. And also, if you are pregnant and you have hypothyroidism, you need Synthroid. If the newborn is having hypothyroidism, by the value of TSH, we need Synthroid. But we cannot get to know that without thyroid function test done. And how can you get thyroid function test done? You go to your physician, please. Why the emphasis on this? I don't support self-medication. Why that? In certain parts of the world, there may be no regulation as per what to buy and what you cannot buy. So, don't walk too fancy and spend your money getting Synthroid that may kill you. Because you don't know. You may not have hypothyroidism. Even if you have hypothyroidism, without determining the level of TSH, you may not know the appropriate dose. And if you don't know that, and you treat yourself to complications of hyperthyroidism, then you are doing more harm than good. So please contact your physician. That is why I'm here. Stay healthy and continue to enjoy your life. With that, I've come to the end of this short presentation as per how helpful Synthroid can be in studying cases of infertility, pregnancy, and newborn. Thanks for listening. Please remember to share this. Remember to subscribe to my channel. I appreciate it.